Hi, Dr. Landon Pryor from Pryor Health. I want to cover briefly some procedures that can be done under local anesthesia with minimal downtime and potentially, especially as we move in towards the end of the year and people have used up their deductible, something that your insurance company might consider covering for medical necessity in some situations. Worth considering as we move in towards the end of the year. I've talked briefly about upper eyelid rejuvenation or upper eyelid blepharoplasty. Typically, insurance will cover that if there is functional impairment, which means obstruction of your vision, usually peripheral vision. That's something that we can evaluate you for. Skin tags, something we do a lot of here, not something that typically is covered under insurance, but potentially could be depending on your insurance, depending on if the skin tags are symptomatic, if they're in specific areas that would require medical necessities. Just keep that in mind. Moles and cysts, those are other typically benign skin conditions, but again, depending on your unique clinical circumstance. Sometimes moles can get covered if they're changing, if they're symptomatic, if they're itching, if they're in areas that cause functional impairment. Same thing with cysts. Anytime that we need to rule out any kind of malignant neoplastic diagnosis or potentially a skin cancer, those can get covered. Cysts, if they're getting recurrently infected or draining or enlarging or causing functional improvement, again, that's something that might be considered by your insurance company. We help facilitate that approval or denial by the insurance company, and obviously we can always proceed without insurance if for some reason it gets denied. Other things also that might get approved would be surgical scar revisions. We have lots of patients ask about scar revisions in general. This could potentially be for workers' comp if it was a employment-related injury. It could be an accident if it's car accident or a work-related accident. It could be iatrogenic if it's some kind of other type of injury related to injury or resulting injury from a healthcare related surgery, or just scars in general. Sometimes if there's medical necessity, if there's scar contractures, if there's pain, if there's limited range of motion, these are things that potentially could be approved through the insurance company as medically necessary. So something to think about as we move in towards the end of the year. With most people have already met their deductibles, definitely worth considering. A couple other small things that also might be considered medically necessary. We see a lot of what's called lipomas. These are fatty tumors that are typically located either subcutaneously under the skin or intramuscular within the muscles itself. Depends a little bit on the location, the size, the amount of symptoms associated with them for it to be considered medically necessary by the insurance company. But of course, we can have you come in, evaluate it, take photos, document the medical history, and then decide from there if this is something that would meet medical necessity criteria. Two more things. Acne scarring, we talked about a little bit, generally considered quote unquote cosmetic, but if that's something that you want to consider through your insurance company, depending on your insurance and the specifics related to your acne scarring, there may be consideration for approval, especially if it causes significant psychological trauma, which obviously we know acne scarring can do. Finally, we talked about this in earlier videos, but labiaplasty, again, generally considered cosmetic, appearance related, but can also be one of those gray areas where there's overlap. And as the labia become more symptomatic, they can potentially be considered medically necessary because they cause functional impairment related issues, pain, inability to exercise. Definitely something worth considering.